Now to discuss is risk and behavioral scientist Dr. Shudder Chakraborty. Doctor, a lot to discuss now with these new rules from the CDC, obviously limiting people from being part of these gatherings of 50 people. Is this the right move? Is this how we're really supposed to social distance from each other?
So the CDC is the gold standard. Along with the World Health Organization, the experts there are overly cautious. And so if they're recommending something, they are still erring on the side of caution. And that is something that the American public needs to take very seriously and heed. That being said, these don't need to go into effect until intensity of community transmission is understood at the local levels. And so that requires conversations across all of the stakeholders, the medical community, the scientists, epidemiologists, social scientists, bioethicists. These conversations are critical because the timing is going to be really critical to make sure that we don't experience a public that is no longer compliant to the very important recommendations the CDC has put forward.
The first clinical trial for a vaccine for COVID-19 is happening today. Explain that to our viewers. What does that mean?
So there is not a single prescription drug, regardless of what class of drug it is, that can be released out into the public unless the appropriate safety trials and for efficacy and tolerance in a public is really taken. And that takes time. First, we have to try animals, and then we have to try humans in different populations. And the last thing you want is to put a chemical molecular entity out there that has worse outcomes than had it not been put out there. So the same way you wouldn't release an untested vaccine, it's extremely critical to make sure that all of that goes into, those trials are really taken seriously before you release it, because you wouldn't want, again, the outcomes to be worse than had it not been received, had it not been actually tested. So the process is starting and it's being fast-tracked, but there's only so much you can fast-track something when it still needs to go through its due diligence before it makes it out there.
In the meantime, we're hearing of more and more diagnosed cases. Where do you see this going in regards to how many people will be hit with the virus?
So let's say the worst case scenario now, as the CDC understands it, is that this is 10 times worse than the flu. That's most likely what it's looking like at the moment. And hopefully that mortality rate comes down. That is hundreds of thousands of Americans infected with this virus. This is a serious risk, without a doubt. There's nobody questioning that. But ultimately, the measures that are going into effect have to ensure that the overall outcomes of those infected and killed by this disease are going to be benefited by these measures and not made worse. And that's delicate to do, especially when we're experiencing this in real time. It's not always obvious and easy to tell. So the best way, again, to do it is to understand what makes the most sense for the community at the present moment in comparison to other disease states and looking at the risk in relation to other risks. So what is still the greatest present danger for a particular community? How does it relate to the flu? How does it relate to those who will need hospitals for other chronic diseases that they're dealing with? These are all very delicate considerations, but this big picture needs to be looked at, because this COVID-19 does not exist in a silo. It's not COVID-19 and nothing else. We need to think about the other disease states that could potentially be negatively impacted because of the time, attention, and resources we're giving to COVID-19. And we need to think about the measures and the ripple effects that will come from that, the socioeconomic impacts and the public health outcomes, mental health illness that could potentially be exaggerated because of some of these measures. These are critical to keep in mind as we start thinking about the different ways we are going to roll out these recommendations.
Italy is very bad off, as we reported earlier. So respond to this. The Surgeon General says that we could be worse than Italy.
So that's true in the sense that we don't know exactly what unique characteristics of different geographic locations and cultures result in some of these increased transmission rates in certain parts of the US and around the world. And so we have to be vigilant and keep an eye on it. It's definitely true that there's still a range. A lot of this is still very fluid. The infection rate and the mortality rate changes, as we're seeing, from epicenters like China to now to Europe. And so as Americans, we need to stay vigilant. But again, we need to make sure that we are putting in place measures that are aligned to the current present risk, because we don't want to make it worse. In the same way, we don't want to fast track a vaccine before we know that it's safe, and it can be safely rolled out across those that are most vulnerable and would benefit from it. In that same way, we need to make sure that other measures we're rolling out are also aligned to the reality of what we're
So
experiencing.
even though the testing is happening right now, an actual vaccine may not be available for another 18 months. Is
That's right.
What we're reading. Okay,
That's
that
right.
is Dr. Shada Chakraborty. She's a risk and behavioral scientist. Doctor, thank you so much for coming on today.